The World Health Organization estimates that 250,000 people die each year due to climate change, and it hits the most vulnerable communities hardest. In response to a White House executive order, the Department of Health and Human Services has established an Office of Climate Change and Health Equity. Rachel Levine is Assistant Secretary of Health at the Department of Health and Human Services. Rachel, welcome to the program.
Well, thank you. It's a pleasure to be here.
Can you explain how climate change affects people's health? I mean, aside from the obvious of people dying from climate catastrophes.
Well, you are entirely correct. I mean, we are seeing right now how climate change is impacting health with heat stress, wildfires, air pollution, severe storms that are still impacting the South, and flooding. All of these impacts affect health. They worsen heart and lung disease. They can expose people to mold and bacterial illnesses, certainly impact mental health. And climate change also leads to changes in our natural environment. So we can see, for example, more vector-borne diseases, such as Lyme disease. It can impact our crops, our clean water supplies. So the list goes on and on. Climate change is negatively and severely impacting our physical and mental health in the United States and throughout the world.
So explain what's meant by health equity.
Well, health equity is that everyone really deserves the right to good health. But the fact is that climate change, COVID-19, many things that impact our health impact some communities far more than it impacts other communities. They impact specifically vulnerable communities, communities of color, such as African American communities, Hispanic communities, and American Indian, Native Alaskan communities. So that is true for climate change as well.
So your office has to first identify communities more vulnerable to the effects of climate change. How do you go about doing that?
Well, so we are looking at different databases. So we know where health disparities are. There is actually something called the Health Disparities Index that is produced by HHS, and so we can see which communities are impacted in terms of health disparities, and then we can correlate that with the impacts of climate change. Again, they're right before us in the daily headlines, such as heat, wildfires, smoke inhalation, and then the horrific storms that have impacted the United States this year.
So what resources then are needed to support those vulnerable communities?
Well, so one of the things that this office is going to do is to look exactly at that fact, is that where are the impacts of climate change impacting communities most, impacting those vulnerable communities that have those health disparities, and then how can we marshal really across the Department of Health and Human Services, and then the administration, the resources necessary to establish health equity and to eliminate those health disparities and prevent them in the future.
You know, another issue is climate migrants, right? Not just the people coming across the southern border, but people fleeing climate disasters. Will your office consider that group as a vulnerable community?
Well, public health doesn't align necessarily with borders on the map, and certainly the impacts of climate change are felt globally. So this office is nothing to do with politics. It's really working for a healthier future for ourselves in the face of climate change, and climate migrants will be a part of that.
So one thing your office is tasked with is to foster innovation in climate adaptation and resilience. Will you be working with the private sector for that? How are you going to access that kind of innovation?
Well, we are absolutely going to be working with public-private partnerships. So one example is that we're already working with the National Academy of Medicine. They have established the health impacts of climate change as an absolute priority for them. And I am very pleased to actually co-chair their collaborative on that topic with Dr. Zhao, who's the president of the National Academy of Medicine. One thing that we're doing is that we've had meetings already with health systems to look at the climate change resiliency of health systems and hospitals throughout the country, but also the carbon footprint of the healthcare sector. I mean, the fact is actually the healthcare sector in the United States and globally has a very significant carbon footprint. So in addition to looking at the climate change resiliency of these health systems, we're going to help them and innovatively brainstorm ways that they can decrease their carbon footprint themselves.
You know, Rachel, it's a big job. It's an important job. What will you hope to accomplish first? What do you see as your highest priority?
Well, there are so many priorities. I think one of the priorities that we have first is the impact of heat, which has been impacting so many areas of the country. Of course, in the Southwest, but even actually in the Northwest, where there have been significant issues about heat in Portland, in Seattle, and throughout those states. Those impact vulnerable communities harder. Not everybody has access to air conditioning. Not everybody might have access to always to potable water. So there is actually a administration-wide effort that we are co-chairing on those heat issues. The other priority is actually what I just mentioned, is working with the National Academy of Medicine on climate change resiliency for the healthcare sector and reducing the carbon footprint of the healthcare sector.
Well, Rachel, as I said, it's very important, and we can't wait to hear how things go. Please come back and check in with us at a later date and let us know how you're doing. Thanks so much for being on the program with us.
Thank you so much. It was a pleasure.